Now, a Section 59 panel set up to probe complaints of discrimination against black health professionals by the medical aid schemes has handed over a scathing report confirming allegations of unfair treatment of black healthcare professionals by the country's three biggest medical aid schemes. The panel recommends amendments to Section 59 of the Medical Schemes Act as it doesn't contain the procedures for administration nor regulations. Health Minister Dr Aaron Motsoaledi says it's a shame that there are still incidents of racial discrimination more than 30 years into South Africa's democratic dispensation. Now, to talk to us more about this, we're joined by Dr Mvuyisi Mzukwa from the South African Medical Association. Dr Mzukwa, very good evening to you. Thank you so much for joining us. Welcome to the late edition.
Good evening to you and to your viewers, and thanks for having me in your program.
Well, it's an absolute pleasure. Very, very scathing recommendations, I would say. What's your immediate reaction to the Section 59 panel's findings, confirming racial discrimination by South Africa's largest medical aid schemes against black healthcare professionals?
Well, as an association that represents the interest of doctors and patients in this country, we welcome this report with its findings and recommendations. And as it was outlined yesterday. So as the South African Medical Association, we've always participated in this in this matter. In 2019, I was deployed by the South African Medical Association as the vice chairperson to be part of the steering committee that was established by the Council for Medical Schemes. So we're waiting for this period. For many years, we've been wondering what is happening with this report. But we are pleased that at the end of the day, the report is with us and we can see the findings, because we see that there are serious procedural shortcomings that were identified by this report. These include a failure to notify the providers of alleged irregularities. It also showed, that audits were stretched far back more than 3 years. And this is what has been troubling us as providers.
You speak of procedural shortcomings, and that's very concerning because it concerns our health, in its entirety. Were these findings expected within the medical community, or do they come as a shock in terms of their extent and severity?
Well, it didn't come to us as a shock because you will recall that some of the colleagues, our colleagues, have been severely affected by this psychologically. Some of them have lost their properties, they have lost their businesses, they have lost their livelihoods. So it didn't come as a surprise because we've been complaining about this to say that we think there's so much unfairness, and it had been now confirmed by the report that is, the schemes were racially biased when it comes to these processes of fraud, waste, and abuse. And as the South African Medical Association, I think we need to stress this, that we do not condone fraud, waste, and abuse as an association, but we believe that processes should be fair, should have justice, and should be transparent, which was not the case as outlined by the investigation now.
Words being thrown around such as fraud, waste, and abuse, and you just spoke of some of the inefficiencies in terms of the black doctors being discriminated against by the big medical aid schemes. But what really are they? What are they? Can you maybe explain how this discrimination manifests practically for black doctors and healthcare professionals in their day-to-day dealings with the medical aid schemes?
Well, as it has been shown statistically by the report there are, we find that the schemes, they are more biased towards finding black professionals guilty when they do this fraud and investigation, as if you compare them to their white counterparts. So this is what is in the report. It was confirmed by a person who's trained in statistics, and also, people have been working on this matter, seasoned lawyers. So I do think that in this case, if people have a problem with what is written there, they should be challenging it. But all we know now is that, seasoned lawyers and also experts have come out, with a report, and they've tabled the report, and they've confirmed what we've been complaining about, to say that within the process there's no transparency, and we think that there's a bullying in the process, because you find that you get these guys that just come in there and say they demand documents, they demand this. But we've been always saying that we think we need to be respected as professionals. Even if a person is found guilty, by the way, they need to be treated with fairness. They need to be, we need to know the processes, all the algorithms, they need to be transparent about them.
And do you think regulatory bodies like the Council for Medical Schemes have been proactive enough, in dealing and addressing some of these complaints historically, or has there been a failure of oversight on their part?
Well, I think in this case, when we laid a complaint, we were told that the Council for Medical Schemes is not the relevant body to be dealing with complaints that come with professionals. They protect the interest of the patients and not of the providers. So we were left, wondering where to lay our complaints when we have serious problems with the medical schemes. Hence, then we are calling for a legislative changes, but also regulatory changes that would accommodate providers. When providers have a problem with medical schemes, they need to have a platform to report, but also they need to have a platform, to challenge, some of the tendencies by the medical schemes. Because they don't do these things to these big hospital groups. They target the small, practitioners who are having small businesses, and they kick them out of their businesses. And this is what we have seen in the past. And that's what we're complaining about when we table the complaints to the Council of Medical Schemes.
All right, Dr. Mzukwa, great chatting to you. And I suppose what's even more heartbreaking is the fact that such discrimination ultimately affects us, the public, the patients, and the broader public health system. We certainly hope that it'll be addressed quite decisively. Great chatting to you. Thank you so much for your time.
Thank you.
All right, thank you. Well, that was Dr. Mvuyisi Mzukwa from the South African Medical Association, just sharing with us the findings of the Section 59 panel set up to probe complaints of discrimination against black health professionals by medical aid schemes.